Much of the work that we do as humanitarian practitioners is divided quite falsely into either humanitarian or development work. And I think today we're going to see that the linkages between those two and the kinds of programming needed are quite similar and might differ in their timescales and the rapidity which things need to happen, but that at the end of the day, the work itself is quite similar. That being said, we are focusing on humanitarian emergency situations here, and I think what we are asking ourselves is, is there work that we can learn across these two divides, humanitarian and development, and what is the role for economic strengthening interventions, specifically in emergency responses, and what can we learn from the other work that's been happening. To that end, I'm very happy to introduce our panelists, whose name I just called to get them up here. I'm not going to read their biographies because the programs have that very nicely, and we obviously want to save as much time as possible. But we have Abel Mwebembezi from Reach the Youth Uganda, and also Columbia University's International Center for Child Health and Asset Development. Timothy Opobo, who also, as we are speaking of children, is the father of a new baby girl as of a few weeks ago, so applause. Timothy works for ChildFund Uganda, where he is also the in-country coordinator for the program learning group of the CPC Learning Network. Eunice Muthengi of Population Council in Kenya, and Josh Chaffin, who is based at the Women's Refugee Commission in New York and houses the CPC's Livelihoods and Economic Strengthening Task Force, which has technical support from the man we've heard a lot about today, Fred Ssewamala. Who would like to go first here? I was going to ask Josh because he was going to do an overview presentation, but it seems it's not loaded. So while that gets... there we go. So this is going to be an overview, and then we'll ask each person to talk about the specific work that they've done. So with no further ado, Josh Chaffin of the Women's Refugee Commission.
Hi, thanks, Mark.
And do we have a timekeeper here? Be very strict, please.
10 minutes? Okay. I will go fast. Thank you, Mark. I just want to talk about, so the goal here was to do a big question mark around the role of economic strengthening interventions for children and youth in emergency settings in particular. So I'll talk about some of the overarching issues in the context of an intervention that we're going to be trying to test with, alongside UNICEF, the Child Protection and Emergencies Unit at UNICEF. So first, let me just define some terms. What do we mean by emergencies? There are several blunt categories, 5, 6, 7 blunt categories of emergencies that we've identified with UNICEF and an expert group. So anything from a rapid onset disaster like a Haiti earthquake, urban displaced emergency context, something like Nairobi in Kenya, where you have maybe 1 million people coming to live in a major urban setting. You have protracted camp settings like Dadaab in Kenya. You have slow onset disasters. Some of them are cyclical. And then you have mass influx disasters, conflict related, such as a DRC. I'm not turning the page here. So your economic intervention and your other interventions are going to be completely context specific, and given those five blunt categories of emergencies, you're going to have probably so you're going to have context specific limitations on what you can do and opportunities. What do we mean by economic strengthening? I feel like this question hasn't even come up yet today, and it's super important. There are dozens of ways you could try to shore up a household economy or an individual economy. Skills training, IGA projects have come up earlier, microcredit, savings, it could be individual savings, it could be group savings, jobs development, cash for work, food for work, value chain development, introduction of labor-saving technologies, financial education. So some of these are more or less appropriate for implementing with young people. And some of them are more or less appropriate depending on what kind of emergency we're talking about. Just in general, lack of economic security is a major protection and well-being risk, and this is especially true in emergency settings. So before, during, and long after an emergency, a lack of economic security will cause protection and well-being risks for children, not least because they resort to harmful coping strategies. So this leads them to being in the community, for example, selling on the street if they don't have the economic means in and after an emergency. It leads to their risk of recruitment or re-recruitment into militias, gangs, etc. And it leads to this phenomenon of sexual exploitation and abuse by humanitarian workers, by peacekeeping forces, et cetera, in an emergency. So there's a spectrum of protection and well-being risk associated with an emergency situation over and above the protection and well-being risks that we have in a resource-poor environment to begin with. Why are we talking about economic strengthening for children in emergencies? First of all, maybe most importantly, is that children in emergencies have economic lives already. So whether or not we want them to be, they will often be, adolescents will often, sometimes the majority of adolescents in a resource-poor environment will be working to support the family. This is especially true in an emergency setting. Also, adolescents tell us in our research over and over again, so Liberia, Ethiopia, Tanzania, Uganda, Kenya, et cetera, that they value the economic contribution that they can make to the household. So this is something that they're asking for. The response to date by humanitarian agencies has been spotty and often non-existent in terms of economic strengthening, partly because economic strengthening is nobody's mandate. It's kind of a hot potato. Many agencies are afraid to get involved with economic strengthening. As Abel already pointed out, many agencies don't want to fund it for various reasons. Not least of those reasons is that they're afraid of encouraging quote-unquote child labor. So this is a legitimate fear, and it just points to the need for economic strengthening response to be age appropriate. As a result of this hot potato problem, economic strengthening is often introduced into a program, say a program that has some public health goal, for example, an HIV program. Economic strengthening often comes as an add-on at a later stage when program managers realize that the uptake of their program is disappointing, and the kids may tell them, well, I don't want to pay the economic cost, I don't want to pay the opportunity cost of coming to your HIV sensitizations unless there's some kind of near-term economic benefit for me. This is something that we hear from families often. So economic strengthening programming gets added on to other kinds of programming. And it's been shown that economic strengthening programs are one means of making behavior change programming, reproductive health programming, HIV/AIDS programming more effective. So we have this hypothesis working with UNICEF and other partners that economic asset-based interventions of some kind, depending on the context, as part of an integrated approach to protection and empowerment, could play an important role in this case, one outcome that we're particularly interested in is gender-based violence prevention in emergency contexts. So we think that if we're doing economic strengthening programming, that we could possibly get better outcomes in terms of GBV. So how do we think that we could go about this? Well, we came up with, as an expert group, In addition to basic education, we came up with a minimum package that includes features like safe spaces for girls to interact, to have friends and to interact with their friends, a place where that they can interact with adult mentors who are not their parents or family members, a place where they could get access to life skills education, especially including sexual reproductive health information. And then on the economic side, as a basic part of this minimum package, we think they should have access to vocational skills training in some form, to financial education in some form, and crucially, a way to save money somehow, either as individuals or as a group. Right, so then, assuming that's the basic package that we want to do, in any kind of disaster, depending on the context and the age of the kids, you're gonna we talked about in an expert group about ways that we could intervene with other kinds of economic strengthening interventions, and this again is going to be completely dependent on your context. So we thought in a rapid onset disaster, just for an example here, if the girls were ages 10 to 13, that we might be able to deliver cash or vouchers for the household, especially if these are child-headed households. That cash for work might be an effective intervention through mentoring. So we get mentors involved with these girls, and we can make that a cash for work intervention. Giving access to girls, to safe spaces for girls, and connecting the girls to other kinds of services. So these are age-appropriate services that aren't about labor and working, because these are 10-year-olds, 13-year-olds. But then at older ages, we were thinking maybe they could get access to unconditional cash, that they could get access to creation of safe spaces connected to IGA, so income generating activities with cash, and coupled with cash and training. And then just for an example of an urban displaced setting, if the girls were over the age of 15, for example, and I'm thinking here about like a Nairobi kind of setting, that a package might include things like micro-franchising. Like you see here, these girls are selling products of an established firm, a Kenyan firm, that they could get access to job placement or training. Because it's an urban setting, you have access to lots of private sector firms. That they could get access to actual banks for savings, to village savings and loans. That the NGOs or agencies could help them get access to IDs and papers so that they could work if they were non-nationals. And then, things like childcare would help them access the program. And then, we could also help them, if they're out of school, we could help them get access to literacy and numeracy training. I'm probably out of time. This is the last slide. But in any case, as I said, the actual package that you come up with for children economic strengthening in any setting is going to be entirely based on an assessment of their needs, and a few program principles that we came up with that we're hoping that everyone involved in this study can adhere to are that any intervention that you do be based on analysis of goods and services. And that analysis should be gender sensitive, and that we're hoping that we need to be monitoring to ensure that programs lead to some kind of decent and safe work. And I will leave it there. Thank you.
Don't you just love it when presenters finish right on time and you don't feel like you had to squeeze the last few minutes out of them? Thank you for that overview, Josh. And I think there were some really good reminders in there that economic strengthening comes in a lot of different models and modalities for delivery. But what resonated with me the most was this comment, children have economic lives. And it just made me think, we hear frequently things like we all have emotional lives, we all have sexual lives, but we all have economic lives. I personally would like to pretend that I don't, and that I never have to look at my bank account or work on checks or any of that, but we do, and children do, and their contribution to households, as you pointed out so rightly, is generally considered a positive thing, and that is something contextually that we need to remember. Moving on to our next presenter, Eunice Muthengi of the Population Council in Kenya. will be presenting on the inclusion of social and health components in economic strengthening programs for vulnerable adolescent girls. Over to you, Eunice.
Thanks. So this actually flows pretty well from what Josh just talked about. And so, as we know, as a background that in Sub-Saharan Africa, especially health behaviors are often influenced by economic needs. And the findings that I'm going to share today are from a project that was implemented in urban slums in Nairobi and in Kampala in Uganda. And especially in the slum settings, we find this to be very true, that girls' decisions around sexual behavior and around health behavior are influenced by their economic needs. And because of that, we found that it's very important, as Josh talked about, to make sure that we're addressing their social, human, and in a comprehensive way by building these assets. And based on this asset building framework, where we look at assets as a store of value, both to reduce vulnerability and to expand opportunities. And this is not just tangible assets, but intangible assets such as social, health, and education competencies. So this was the Safe and Smart Savings products for vulnerable adolescent girls in Kenya and Uganda was implemented between 2009 to 2010 and funded by Nike Foundation. It's based on the Safe Spaces model that Josh mentioned, where girls were grouped in 20 to 25 girls were grouped together, living in the same community, and they were assigned a mentor who came from the same community, understood the issues that they were dealing with in these urban slums. And they met weekly, and there were discussions around financial education and reproductive health following a set curriculum. And then the girls also had the opportunity to open a savings account. And these two savings products were actually developed. At that time, they weren't such savings products that adolescent girls could have access to, girls between the ages of 10 and 19. So these were developed following a lot of market research that was done in collaboration with MicroSave. I just do? Okay. So the findings I'm going to share are based on both quantitative and qualitative studies that were conducted. And in Uganda specifically, there was kind of what we've been calling a natural experiment, where some of the girls, although the program was designed to address social health and economic assets, in Uganda, some of the girls only opened savings accounts but weren't mobilized into the groups. And this kind of happened, it was a kind of a programming error. But because we had collected data on these girls at baseline and were able to follow up with them at endline, we were able to kind of look at the differences between the girls who had a savings account only and girls who had a savings account plus were in the safe spaces groups, and we see that reproductive health and financial education. And then there was also qualitative data that was collected using focus groups. And when we looked between what I'm calling the group girls and the no group girls, so the no group girls are the ones who only had a savings account but did not participate in the social and health components. There were no significant differences in terms of any of the socio-demographic characteristics. But then we had a comparison group that we compared these two groups to, and there were differences between those who participate in the program and the comparison group, and in terms of schooling and SES, and we were able to control for these in the multivariate analysis. So I'm going to talk a little bit about how we see that economic strengthening could potentially increase risk and vulnerability, and then how incorporating social and health components can help to mitigate against these risks. So in the analysis, we found that when we looked at the girls who participated in groups and the girls who didn't, and compared them with a comparison group, and then we looked at the change between baseline and endline and looked at how this change was different, we found that girls who did not participate in groups actually had a higher risk of experiencing sexual harassment, whereas girls who were in the groups did not, there was no difference between these girls and the comparison group. And again, this is looking at the difference between baseline and endline and how that change was different. And just to share with you some quotes from the qualitative data that kind of helps to explain this and to illustrate this, there was a common concern about harassment from boys who were jealous of the girls' accounts, or being teased by boys, including schoolmates, brothers, and boyfriends. And these are two quotes where a girl in Uganda said, "Some people may beat us up, stepbrothers may see you saving and he is not, so he may ask you for money. If you refuse, he may even beat you up." When he and my brother sees that I'm putting away this money, he starts pushing me and beats me and tells me to give him the money, that it is his. And when I report it to my mother and get the money from him, he says that I stole it, that it was his. So girls reported experiencing some harassment, especially because of the fact that they had money and they were seen as because they had the savings accounts. And also there were reports of some risky behaviors to access money. So for example, the first quote where a girl says, yeah, because if I do not have money, for example, me, I'm not saying this is true, but I'm giving an example. When I do not have money and I've told my parents, and he does not have money and I need to save, I have to go and find some sugar daddy there. I tell him to give me some money, and thereafter I give him a kiss for appreciation. Another girl said, for the problem is that we are grown-up girls, when we are pressurized into saving, we end up going to sugar daddies. And the quotes that girls, where they talked about this issue of engaging in risk behaviors, it wasn't clear whether they actually engaged in them or whether they were talking more speculatively, but this was something that came up. And then quickly to go into how these risks and vulnerabilities were reduced. We found that overall, girls who had a savings account, whether they were in groups or not, showed an improvement in financial education and financial literacy, and improvement in their having economic assets from baseline to end line. So you can see here that for both of these, whether they were in a group or not, they were able to say, they said there was an improvement from baseline to end line in whether they said they had a budget, whether they could, for those who were, whether they could correctly name 2 reasons for savings, their improvement in having saved any money in the previous 6 months, and then also there was an increase in using formal methods of saving versus informal methods. And then from the qualitative data, we're able to see how having these economic assets actually improved girls' lives. Okay, so for example, girls talked about how because of these having economic assets, they were less dependent on men. These are a couple quotes that illustrate that, that because they had money, they didn't need to rely on men, and also that they were empowered to refuse sexual advances because they had access to this money, because they had savings and they had their own money that they could go to if they had certain needs. So those are a couple of quotes that illustrate that. And just to wrap up, we also looked at, for girls in groups, we looked at whether those who showed an improvement in social and health assets were less likely to report having experienced sexual harassment. And these results show that, yes, girls who said they had somebody to borrow money from in case of an emergency, or who showed improvement between baseline and end line in health knowledge, were less likely to have experienced sexual harassment. And so just to wrap up, that that girls with economic assets are more economically independent, and less likely to rely on men to meet their daily needs. But there can be a risk associated with economic strengthening, especially if this is done without having without strengthening, I guess, girls' other competencies and other assets. So it's important to include social and health, to improve social and health assets by including these components in the program. So you're addressing all of the girls' needs in a comprehensive way. And just acknowledgements. Thank you.
Thank you very much, Dr. Muthengi. And something we've started to talk about today that I hope we can really delve into as the day continues is the gender and gendered element of economic strengthening. When you said your first sentence, in Sub-Saharan Africa, health behaviors are often influenced by economic needs, I thought, what if we took the first 3 words off? Does it still hold? Health behaviors are often influenced by economic needs globally, and I think that is. But as you kept presenting, I thought, gender is just as important here, and you guys are really delving into the way that economic strengthening is changing gender relationships. And I think any program that makes women less dependent on men is something to be congratulated, and I'm really glad that you're able to show what's working. For our next presentation, we will hear from Mr. Timothy Opobo of ChildFund Uganda. And before Timothy starts, I also, something else that struck me in your presentation was the use of a programmatic error as an opportunity to create new learning about different models of economic strengthening.
Thank you, Mark. What am I doing? Okay, I'll just start with we've been hearing about the Child Protection in Crisis Network, and ChildFund Uganda is an active member of the Child Protection in Crisis Network. Lindsay is going to say more about what the Child Protection in Crisis Network is, which ChildFund is a host organization, and I coordinate the program learning group in Uganda. I guess going back to Josh's definition of what, what fits the definition of emergency, I'm not really sure my presentation does fit his definition, but going back also to what Mark said, the thin line between the emergency context and the development context. But I'll take the HIV situation in Uganda that many of you have heard about already today as a crisis situation, and Fred also talked about this in his presentation, talking about the child crisis. The statistics that we have, I think we've had over and over the fact that we have an issue around orphans as a result of HIV, and but also the fact that the vulnerability is categorized in Uganda along about 14 indicators, and one of the key things is that out of all the children that we have in Uganda, up to 96% of them are seen as vulnerable in one way or the other, and up to 8 million actually critically vulnerable, majority as a result of HIV/AIDS. But also the fact that we have up to 50,000 children living outside family care is something also that raises concern. I'm going to talk about an intervention that ChildFund is rolling out, has rolled out in Ethiopia, and plans to roll out in Uganda. And it's more of an integrated, holistic model that actually focuses on economic strengthening as a component of, an integrated approach. And one of the things that we are doing in Uganda, and we hope to learn from, is actually looking at the household, looking at the child, looking at strengthening the household and the family, but also looking at the community and looking at the different elements or structures within the community, looking at the protection setting, looking at parenting as an issue, and also looking at how we link protection systems, both formal and informal, within the communities and families where these children come from, and seeing how do we then strengthen the family to address the needs of the child, economically that is. My emphasis, though, is going to be on the household economic strengthening model that ChildFund is rolling out at the moment. This is drawn from, I think, a number of interventions that have been undertaken this far, and one of the things is categorizing and recognizing that vulnerabilities differ from community to community, from family to family, and therefore categorizing families into what we call, destitute families, struggling families, and then growing families. And the intervention we're rolling out is therefore looking at stabilizing the destitute family and then increasing the purchase power of the struggling household, and then having income diversification for the growing family. Now, what we really do is use what we call the Child Status Index, but we also are using what we call the Vulnerability Household Index to identify and categorize the different vulnerabilities the different levels of vulnerability of households. And the Child Status Index actually looks at the individual child in the household, while the Vulnerability Household Index looks at the household as a whole. And therefore, we categorize them into these three categories that I have mentioned. And the idea is that we therefore then focus on the different interventions for different levels of vulnerability. So you have, for the destitute household, the focus would be, to recover assets and stabilize the household, as I said, then build self-insurance mechanisms and protect key assets within the family, ensure smooth household consumption and manage household cash flow, smooth household income and promote asset growth, and then finally expand income and consumption. That is for the growing households. So this is really more of the interventions within the different categories that I have mentioned, and it will be more or less repeating what I've said. If you look at the bottom for households in destitution, we are looking at households that are actually having trouble meeting their basic needs, and therefore the focus is stabilizing this household and therefore providing these basic needs for the household. They have little or no source of income and significant debt in some cases. They have no liquid assets, classified as food insecure and often labor constrained. So that is what would be defined as a destitute household. And then the struggling household is one that can meet basic needs, one or more fairly predictable sources of income, some liquid assets. Okay, good. And then, the growing household is in a better situation, but there's a need to diversify on the income sources. So the idea is that the strategy here is actually, for the destitute families, what we're looking at is interventions such as cash transfers and asset transfers. And then for struggling households, we're looking at cash management, saving and credit, and financial literacy. And for the growing households, we're looking at increasing their productivity and diversification of income. Still, same explanation across, but we then have, for very specific interventions around struggling households, right at the bottom from, having them into saving and credit investment groups. Then we have basic business skills, and then youth vocational training for the different levels in the struggling households. So that's it. Thank you very much for listening.
Something I forgot to mention at the beginning is that I am a proud practitioner, and I appreciate all of you academics, but it's very nice to see something from the programmatic point of view that's trying to bring in measurement. We were going to have some representatives from USAID here today. I don't know if we ultimately do or not. Anyone? Anyone? No. I mean, the Child Status Index that Timothy mentioned is, in my mind, a watershed moment for international child-focused programmers, because it represents the US government's, and I think you could say for many governments, their first attempt to, and this is an index that they request that all of their OVC, or Orphans and Vulnerable Children programmers, use. It's the first attempt to move from inputs to outcomes for children, measurement of inputs. For years, the US government was simply counting the number of children receiving assistance through their programs. And the Child Status Index was the first attempt to create very basic measures. And I hope that all of you who are working on these issues academically and have much more sophisticated measures can have a look at this index and maybe provide some feedback on it. And just this year, the use of the Child Status Index went from recommended to required. So this is a real step forward for measuring outcomes. When I present on measurement as a practitioner, I used to have a slide that said that the dirty secret is that donors don't actually require that you measure your outcomes. But with the requirement of the Child Status Index, I actually think that changes things. So thank you to Timothy for showing how ChildFund is using that and other indices to start to measure its work. Finally, Mr. Abel Mwebembezi from Reach the Youth Uganda and the International Center for Child Health and Asset Development.
Oh. Okay, as they're looking for my slide, I'm going to talk about something very different, because the first three presenters talked about emergency situations, but almost in normal situations. So for me, I'm going to talk about children under conflicts, wars. What can we do for them? And the reason is that because I've just come back from a war in Darfur, Sudan, and I saw what children went through, and that's what I want to share with you. What can we do for them? I don't know. What should I do? Maybe it is saving me from presenting.
Very sorry, Abel, you're not safe from presenting. Is there anything kind of introductory about the program that you're going to be talking about that you could talk about without the slides?
Okay. So, I'm looking at an emergency as a situation that poses immediate danger to health, life, and property. And in most cases, these are wars. I'm defining an emergency situation as a situation that presents an immediate danger to life and property as emergency. And here I'm focusing on man-made emergencies and also natural emergencies. And we know that natural emergencies are normally diseases, fires, and weather changes. And here I'm going to focus on man-made causes, which are normally wars. What can be done for children? We know the effect of wars on children are very many. They cause death and orphanhood. We are talking about orphans. They cause injury and disability. They're not getting it. What has happened? Oh, I thought I was audible enough. They also cause psychological stress and suffering. During conflicts and wars, there is rape, there is prostitution, forced marriages, and teenage parenthood. There are also cases of child soldiers under these emergencies. There is loss of peer and family identity, and there is loss of education. And as John said, education is a vehicle of everything for development, for life skills, for income. So during conflicts, all this is lost. What programs do we do for children under emergency, and in particular about wars? When we were there, we were designing a program for children, or a program for the operation. And this is what we focused on. We focused on nutrition because people need food during war. We focused on child protection because children are used as child soldiers. We need water and sanitation because without water, children cannot survive. There was very little on HIV and AIDS. And of course, you know, when there is a war, mothers are moving their children who have to do immunization. Education was given very little attention, simply because people are talking about survival and also talking about shelter. There was nothing on economic empowerment, simply because during conflict or war, people are talking about survival. HIV/AIDS, I remember one time we were in a meeting in Addis Ababa, trying to design a program on HIV and AIDS for Sudan, Darfur. One person from, I think it was from the Middle East, he said, Abel, why are you wasting our time? We shouldn't talk about AIDS. I said, why? People go to look for AIDS. They are careless, so we cannot put it in the program. I said, no. Whether people go for it or not, we cannot allow them to die. We need a program. So they were not taking it as a priority. What are facts about children? You see, children during the war, most of them are the ones who are affected, civilian and women. Oh, it has come. Yes. So this is what I was just going through. Children face all that, injury, psychosocial stress, they face rape, prostitution, child soldiers. I want to share with you an example of child soldiers. One day, it was a very, very unfortunate incident when we were there during the wartime. How many? Oh. It was a very big challenge in Sudan, Darfur. A very, very bad incident. You know, one of the activities we were doing was escorting women to go and fetch water. Because if we didn't escort them, the rebels or the Janjaweed would go and attack them. And yet, these rebels were using children to kill UN peacekeepers. So they got children and dressed them. These long mausoleum, I don't know how they call them, these long up to there. As women were going with children to fetch water, all these children were armed with guns. And unfortunately, our neighbors, Rwanda, had just sent a contingent of 150 soldiers. So they went to escort these women to fetch water. Little did they know that these children who were with them were armed. So our soldiers surrounded the women who were fetching water. In no minute, these young children opened fire and killed all the 34 UN peacekeepers from Rwanda, and they were not even 1 week old in the mission. So side soldiers is a common thing. So first about children in the war, 3 minutes. Okay, I will do that, I'll try, so I will jump. Yes. So is there potential of incorporating economic empowerment and for children under war? The answer would be no. We cannot do it. Simply because people are talking about survival. They need food, they need shelter, they need water, they need medicine. So to come and talk about economic empowerment is almost next to impossible. You say my time is gone. So we cannot do much about economic empowerment. We can only give food, medicine, and shelter. You can only give, you have to try to protect the children, to protect their rights. You can provide education, yes, makeshift education. You can stop child abductions, rape, and forced marriages. You can trace children and unite them with their families. In stable operations where there are refugee camps and IDPs, you can do vocational training for children to give them economic empowerment. I wanted to share with you something on, where am I going? iChad. I also happen to work with iChad in income generation. We support them in performance. It has also provided a motivation for children to stay in school. But this can't be done under emergency situations because people are mobile. They're not sure of tomorrow. They don't have anything to eat. They don't know they're going to survive. So this cannot be done. They can only be done under other emergencies, but not under conflict wars. And when we did a program in Uganda on building the capacity of children to do economic empowerment, these were some of the responses that people said in Uganda. Children said, we had lost hope in education, but now we are in school. We acquired skills in IGS. We were mentored, and also we are now engaging in IGS to develop, and this has helped us to develop good morals, and our performance at school has excelled. I will go what I recommend, because I have only 1 minute. I recommend that more research be done on how to support children in conflict areas. There is very little that has been done. If it can be done, that would be very good. And also there is need for research collaboration to enrich research outcomes on children in emergency areas, and particularly during wars. And also we are saying that most of the peace agreements that have been done, they don't include the voices of children. So there is a need with specifics on girl child should always be on top agenda, or of conflict meetings and peace agreements. They don't involve them. And if you don't involve them, you don't address their needs. Some of the challenges are many. Thank you very much. I want to respect the time.
Thank you, Abel, for managing to tell a coherent story, even though we threw every possible technical glitch possible your way. But your comments on the difficulty getting policymakers working on humanitarian issues just to focus on education a while ago, I think that's very apt. When the education and emergencies networks started to emerge 10 plus years ago, the question they always faced was, why education? It's not life-saving. And that term life-saving really makes things difficult for holistic approaches to health and well-being. I mean, what in the world is life-saving? And how can, I mean, just this morning I saw a paper, a call for proposals. If anyone wants to work on this, I'll send it to you. To develop a justification for child protection interventions as life-saving. For any of us who work in the sector, it's obvious that these are life-saving interventions, but whatever humanitarian policymakers use that word in such a loaded way to prioritize what they think of as important versus what they think of as non-important. And I do think that we are reaching the point where economic interventions will get more and more attention, but we're at the beginning of a long learning curve. Before we open it to the group, please be thinking of extremely brilliant questions. I'm wondering if any of the panelists have questions for each other about their interventions. Timothy.
I think, okay. Well, I actually was just listening to Abel's presentation where he posed the question and said, can economic strengthening interventions be undertaken in emergency situations? And he said the answer is no. I wanted to disagree with you actually, because I think the question then would be, going back to what Josh says, how do we define an emergency situation? And if I use northern Uganda, where you had people in internally displaced people's camps for over 20 years, that alone is, in my mind, an emergency situation. So people are living in camps, but you know they need access to resources, and therefore I want to believe that there are interventions that can be taken in that context and can help address these issues, because that still is a conflict environment.
Okay, I will respond. I said in one of my slides that in stable refugee camps and IDPs, vocational training and economic empowerment is possible. But where there is fighting, people are running up and down, it is a bit difficult to do.
I don't disagree with that, but I think that the moment of displacement is the very first piece of a long period that can extend for 20, 30, multi-generational. And yeah, obviously as people are fleeing, you're not going to be trying to do economic interventions with them, but as soon as they arrive, their economic lives will pick up again, and that's where we need to be thinking this through. Just thinking of that, I mean, I think one of the challenges we face is that resources are so easily co-opted by governments, rebels, militias, to perpetrate the conflicts that force people to become displaced in the first place. And there is some interesting work done by a group called the Collaborative for Development Action on how to ensure that the resources destined for populations affected by armed conflict or natural disasters actually reach them rather than perpetrating the situation that caused the displacement in the first place. Josh, did you want to say something? And do we have some hands in the audience? Oh, lots of them. Drat. I'll let Josh talk, and then maybe we'll do 1, 2, 3 in a row, and then we'll be done. You're the third one, right? Was there someone else back there? Great.
Two things. I just wanted to say about Dr. Eunice's work from Pop Council. I'm a longtime admirer of this work, and I just wanted to underline, to me, what the big takeaway is from this work is that when you did an economic intervention with girls who were not in groups, that rates of gender-based violence exposure went up. And when you did it with girls who were in groups, it was GBV neutral, right? It's a huge, am I getting that right?
Yeah.
Yeah. Well, the rates were better when you did it in groups, right? Okay. And that matches with group work that's been done with with women as well. So anyway, just a huge, to me, blinking light that we all need to be aware of. Timothy's household economic strengthening model that he showed, it takes a graduated approach, right? So different interventions for different levels of vulnerability, different levels of poverty. which is a huge revolution in the technology that we use in this industry. The history of this industry is littered with failed economic strengthening programs where they didn't take into account the level of poverty, right? So we just jumped straight to giving somebody credit who isn't even eating, right? We can't do that anymore. So I'm glad that it came out in Tim's slide, sorry.
Thank you. My name is Kasio Motuku. I work for Postbank Kenya. I have got a comment. One of the issues, especially what John has said, the issue of trying to get economic empowerment through income generation, it will lead us into thinking the legal framework in most of the economies, most of the countries where you actually are not allowed, it is illegal to employ a child who is less than a certain age, for example, in Kenya, around 18 years. And in that case, we also are looking at the situation where we've got a lot of dropouts in schools, like we are told of around 57% in Uganda. We don't have the figures from Kenya. And then we have so many of these young people who have dropped out from the educational sector. You cannot employ them because it's illegal to employ them. And at the end of the day, they end up getting themselves employed in the risk behavior, especially prostitution and issues like that. And then it becomes a vicious circle of poverty, involvement in risk behavior and issues like that. And at the end of the day, that child who gets involved in this gets another child when she or he himself is a child. What do we do in situations like that? Yet we are also at the same time protecting the child from employment. Comment as well as a question. Thank you.
Good challenge. Who is number 2 here? Hi, I'm Juliette Sebon from the International Rescue Committee, and I wanted to come back to Eunice's presentation. One of our big concerns at the IRC is when we do economic strengthening programs that we don't put with women and girls, that we don't put them at more risks than what they were before the program. So I think your results were very interesting, but also concerning in terms of actually increased sexual harassment being an outcome of the program. So my question, and we see this more anecdotally from cash transfer program in emergency, for example, and so we're trying to think about this more and how to have some research to see how to not have this happen. So I just wanted to ask you, is from your experience, there were ways to not have this happen? So you talked about group, but maybe in the way the program is communicating to the community, maybe in the delivery mechanism, how do you give the money to the girls or to the women, whether their parents are involved or not in the discussion around the program. So yeah, just get your thoughts on this. Thank you.
So again, my name is Adrienne White, and I'm from the Global Health Institute in Madison, Wisconsin. And my question is about the relationship of national and global economies, as well as large global organizations like the World Bank and the IMF in the success of economic strengthening, and how they might perhaps help or even hinder efforts at economic strengthening. And I wanted you all to perhaps share some examples of this from the field. Thank you for your great presentations, by the way.
Thank you.
Thank you. Maybe we'll start at the end and move our way back here and then close this session.
I will respond to my brother's question.